Hi everybody.
Happy Tuesday.
Happy Tuesday. Thank you for following us again Tuesday, and you're live with your questions.
Yeah. Yes. So we wanted to say it's Cancer Awareness Month. So in loving memory of every patient, family, friends that have lost the battle with cancer, wanted to say it's a good time to remember and remind all the women in our lives to get treated, and early detection can save our lives.
Very good. And also you can post your questions and on the Instagram or also on the Facebook, and we try to cover those questions.
Right.
So we have a topic for today, yes?
Yes.
And before that, you want to say something?
No, well, I'm going to be following around here on all the comments that are coming in. So I see people already joining. So if anybody wants to say hello, where they're from, and if you have any questions, we're going to be answering them live.
Good. So we have questions for?
Yes, I have a few questions that we wanted to go over. These questions are from yourself, and for the people who have dimples, there's a question here, will a facelift affect my dimples?
Dimples, it depends. I mean, like acne scars, I would say no.
Mm-hmm.
So it might stretch it at some point in some areas, but technically no, because the surgery and the facelift is under the skin, and the dimples, if are just, in most of the cases, they are sitting right in the skin thickness, so it shouldn't affect that.
And it's usually affecting the muscle. The dimple is
Dimples are very superficial. They're right in the skin layer.
Mm-hmm.
Yeah.
Okay, do we have any questions?
I think some people were having a problem of hearing, so I think we can talk a little bit louder, or
Oh, okay.
right? Yeah. Okay.
Is that better now? Please.
Thank you for letting us know.
Yeah.
Yeah.
So thank you for that. But yeah, we have Morel 1947. We have MRTN_GR. We have Sandrita BG1. So we have a lot of people joining in right now. So just
Thank you joining us. Let me go over a question which is very common, and about the facelift, since you brought it up, and that was a question. I hear that if we can do the facelift, full facelift, under the local anesthesia, the answer is yes. As a matter of fact, we have done a lot under local anesthesia, and I call it is not a straight local anesthesia, just oral sedation, not a full general anesthesia. We had cases, I remember in the past, that we planned to do it under local anesthesia or oral sedation, because one of the things we always check the patient's vital signs, and monitor the patient no matter what is under local anesthesia or under general anesthesia. But in one of the cases when we noticed the patient is not suitable, we had to abort the surgery. We didn't start actually the surgery, and we scheduled him. That was a guy, and their general anesthesia. So, but most of the cases, yes, as we can do it a combination of sedation and local anesthesia. We can do everything in the face because I block the whole nerves and the patients don't feel anything. However, we have to make sure the case is suitable to do that, because a lot of people, they say, I don't want to go under general anesthesia with them, and I don't know why they afraid, or maybe they had a bad experience or something, but it's doable. Yes, we can do that.
So in other words, if somebody wanted to come in and say, I want it under local, or I want it under general, you would have to give them the okay first.
Yes,
Okay.
absolutely. I have to see the patient. I have to examine the patient. I have to go over the patient medical history, and I need to talk with patient to make sure they have the same expectation of the local anesthesia sedation. Some people they think, oh, I'm gonna go to the surgery on the local, I'm gonna listen to my audiobook, or I'm gonna listen to my playlist. No, that's not the case.
Yeah.
Yes, you have to have a good understanding of what we're talking about local anesthesia or under sedation, to make sure not to get surprised that they are the procedure. And none of the patients, when they go under sedation or local anesthesia, they don't have any surprise, because maybe we take our time to
Yeah,
explain
course.
them.
they
Yeah,
do very
yeah,
Oh
well.
yeah, definitely.
yeah.
Also, a reminder for people who have epilepsy or suffer from seizures, they should never go under a procedure under local anesthesia, correct?
Yes, that wouldn't be safe. First of all, in those cases, we had few. Always we get the clearance from the doctor who's following them and looking after for those medical conditions to make sure the patient is in the optimum situation for that. And considering all of those facts, yes, rather to do the general seizures, better control.
So
Yeah.
we have Bella Della Rosa 91 saying hello from
Hi,
from
Rosa.
Dr. K Plastic
Oh,
Surgery.
Actually, I tone went down.
I think
Actually,
so, yeah,
this
so we
week.
gotta bring
Okay.
it back up
Yeah.
again. We have Maria Lisa, I think she's been following us from the beginning, so hey!
Hello.
We have Pat 4E6 joining in, we have Marisol, we have Vicky 5965, so everyone's saying hello, so we want to say hi.
Hello, everybody. Thank you for following us.
Yeah.
Very good.
So,
Very good.
I wanted to talk about, because I know if anyone follows like the celebrity news or like the gossip that's going on, if anyone has ever heard of like with Cardi B came
Yes.
out and
Yes.
she posted this video because she just had a baby like a couple months ago, and she's like, you know what, my baby did me filthy. I gotta do my breast revision. I gotta get some lipo. So I'm pretty sure a lot of like mothers out there can really like relate, and we call that here the mommy makeover.
That's right. That's
And
right.
some even have like just the breast lift, just no implants, right? Which is the Dr.K
Exactly.
lift.
It's
Yeah.
coming up.
Yeah. So I wanted to talk about a little bit more about that. So.
Sure. First of all, I would say the best thing is after the pregnancy, after the baby comes out, you gotta wait at least 9 months. In my hands, I want to make sure the effect of the pregnancy hormones on tissues have gone away completely, and the tissues are back to their normal base. I know after that we will see the changes, of
Okay.
course, and it's natural to see the changes. That's why we are here, okay? but we don't want to work on a moving target. We want
Oh.
to make sure the tissues are back to their stable situation. Then we make a plan for whatever they need to. And sometimes after the pregnancy they nurse their babies, so we should consider that as well. It's different from the person who is nursing the baby 6 months, 9 months, 1 month, or not at all. So cases are different. So we have to consider all of those. Remember, timing is very important. Sometimes it doesn't matter what we can do, it matters when to do. It's very important, because you never want to work on a moving target. We have to make sure that the tissues are back to their stable situation and make a plan. You mentioned about the Caliph is my signature procedure, but we have some things coming up. We'll show you the details, but technically is a lift that I do, and a lot of people they think that they get the look of the implant without any implant. So without using the implant, but you can achieve the fullness, and it is a breast auto augmentation. Yes, is a part of that, but it's not all of it. This is one of the things I use in that technique, but I use the other techniques that make it happen. We want to talk about the details later on.
Throw a little bit
Yes,
out there.
special,
Yeah.
yes, special videos, just to let you know. Yes, this is my signature procedure, and we have done it. And the good thing about that is the longevity of that. Is the result's gonna stay, and that's a very good with that. And without using any implant, we can get the look of that.
Yes, we're getting the before and after pictures ready. We were very sensitive about making sure we follow procedure with HIPAA rules and regulations. Not everybody is up for showing or sharing their results, and we respect that. So we will be showing some of the before and after pictures of patients who are willing to share their experience and their before and after pictures as well.
Of course, your pictures always is saved in safe computers. Yes, very well protected.
So going back to the mommy makeover, because as I mentioned.
Oh yes. I skipped that.
Yeah. No. So pretty much the mommy makeover is breast, tummy. Like, what would you consider? I mean, it's customized to the patient, right?
Yes. Keep in mind that mommy makeover is not a medical term.
Okay.
Mommy makeover is a made-up term, is a commercial term. Yes, which is okay.
Yeah.
No problem with that. But usually that applies to the people, the ladies, they already had pregnancy, and it doesn't say anything after one time pregnancy or after 5 times pregnancy. It doesn't matter. And then they need some work on their breast and on their tummy area. So it could be, let me make examples of it. It could be just a simple breast augmentation and just a little bit liposuction around the abdomen. So it could be mommy makeover, yes. Sometimes it could be just a breast augmentation, breast lift, and a tummy tuck, and some liposuction. Is it in that category? Yes, it still is a mommy makeover. Some people, we had the breast augmentation, breast lift, tummy tuck, liposuction, BBL, everything at the same time. Is it in that category? Yes. Maybe we have to call it Brazilian mommy makeover. Yes. Yes, maybe we call it a Brazilian mommy makeover. Yeah. It's doable, yes. As you said, the combination of the work on the breast and tummy after pregnancy. However, it still could be without pregnancy or before pregnancy. It could be the case, yeah. So we covered that.
Yes.
All right.
Yes. Do we have any questions yet?
Yes, I do have. I'm gonna have to do some. I think we ran through this in the other segments before, but she's asking in Spanish. I'll read it in Spanish and then translate
Okay,
it in
sure.
English. So she's saying, Doctor, ¿qué recomienda implantes mamarios de silicona o de suero salino? So I think you can understand.
Yeah. I learned that. If I
There
prefer,
those 2 words.
Yes.
Figure out the question.
yes, I think you can
those 2
correct me.
words.
I
Yeah.
think she was asking if I prefer the silicone versus saline. Which
Yes,
one I prefer.
that's
Yeah, I
correct.
learned that. Okay. Yes.
So we answered that before, but
Yes, but yeah, that's her question. Yeah, let me go over that again. It's keep in mind that the implant we offer to you, no matter what, is a silicone filled implant or saline filled implant, or the other type of the implant is called ideal implant. All of them are FDA approved. They're safe to go. I'm not playing with words, but I want to be meticulous to answer that question. Is not one of them is safer than the other one.
Okay.
No. Some of them, they have cons and pros, like everything else. It has advantages and disadvantages. So we need to consider which one is the best. So I'm not gonna coming up and say, oh, I prefer silicone filled implant over saline filled implant 100% of the time. No, and I think it's not correct because some people they need to go with saline implant. And but in general, if you ask me, I'm sorry, if you ask me which one is the most common used implant in my hands, in my practice, I would tell you that the silicone filled implant is the most commonly used. And the patient mostly they feel more natural feeling with that implant. That's my answer. But again, people they can go either way. And again, I had patients. I mean, they had the saline implant when in the follow so later on, or I had done saline implant somewhere else. When I examined them, that was so difficult for me to say is it the saline or silicone. I had to ask them. It depends how much the tissue covering the implant. So it could be the case as well. Yeah.
So if you were to have like 10 patients and examine 10 patients without having to touch them, or having to examine them, would you know who has saline or who has silicone just by looking at them?
at first glance.
And there, okay. Imagine there is no complication after any implants.
Right. Yeah.
No,
Normal
not
breast
really.
augmentation.
As a matter of fact, there was a good study I remember was published in one of the journals. They asked a few plastic surgeons They're just looking at the pictures before after, and by the look, if they could recognize if they are saline or silicone, there was no meaningful numbers to say yes. So there's no definite, just by look, without exam or without asking the patient to.
With saline, I think most people complain or they mention that the rippling is the problem.
Yes.
Over time.
Yeah.
Yes.
Yeah.
And especially
Right away.
especially if the person doesn't have enough soft tissue to cover the implant. Again, if somebody comes to me today and say, doctor, I had a saline implant and I see or feel the ripples, what's the remedy for it? And usually it happens when they raise their arms or lean forward, when the skin gets stretched over the implant. There's a higher chance to feel and to see the ripples. Okay, in that situation, if they ask me what would be the remedy or treatment for it, I would say the first step is to switch with a silicone filled implant, a cohesive implant. However, it's not a guarantee that it goes away, but it's gonna decrease the chance of visibility and filling of the ripples significantly. That would be the
Yes.
first step to do.
Also, I think with the difference in size, if someone starts off with an A cup and a C cup, maybe to even out the size, saline would be the best.
Yes.
If
Yes.
if they're
I
not
mean,
an A
Oh,
cup.
one's bigger than the other when
Yeah.
they start. Oh, okay, okay.
let me put it this words that if we're dealing with the asymmetry in the size, saline is gonna keep the surgeon's hands open or more open to play with the volumes, because the silicone filled implants, they are filled in factory, and the surgeon can use the sizers during the surgery and use the different sizes to match. But sometimes still the factory in a specific range, they make it based on a 25 cc incremental rate. Above 500 cc, the incremental rate is going to become 50 cc. So the surgeon will see itself in a situation that the exact size, if you want it, maybe is not available. So, but with saline, the surgeon is feeling that. If you want to add 10 cc, 5 cc, 20 cc, their hands are open.
Yeah.
But again, is it not impossible? Let me tell you, if somebody is willing to go with silicone filled implant and has an asymmetry, is okay. Still, we can go with a silicone filled implant and try to match the size.
Okay.
So we started with
So
the
if we
facelift, we
have-
moved
I
back
know,
to
if we have-
Mommy, we're going down. We're starting from the head, eventually gonna go down. I want to take a quick break to say hello
Sure.
to people. So we have Leslie Barra saying hello. We have Love Krista Mauro. She's saying hello.
Hello.
We also have Marisol who's saying saludos desde Chile.
Oh, hello.
Saludos.
Hello.
Isn't it big?
Saying greetings.
Greetings,
hello,
oh,
from
okay.
Chile. Yeah.
Oh.
So we have Vida, Luxury and Beauty as well. We have other people joining in. So if anyone has questions, feel free to comment in and we'll answer.
We had patients from Colombia, but not Chile. Did we have? No.
Yeah, we've had patients
Yes?
from,
Oh, okay.
from Colombia, South American.
South American,
Yes.
yeah. Brazil,
Yeah.
yes. I remember.
Yes.
You.
So we're gonna get back to the facelift questions. Is severe pain after a full facelift and neck lift common?
Actually, it's the other way around.
Okay.
After facelift and neck lift, usually the people they don't have pain.
Oh.
Yes, the only thing is because the way I do the facelift is not only the skin, I work on the muscles under the face and tighten as well, because to me, without any deep work, the result is not gonna have any longevity. So we have to work on the foundation of the face, which are the muscles on the face. So because working on the muscles of the face, the patients that have been always told me that for the first week or 2 weeks, they feel some tightness on the muscles. And so for also respecting that working on the muscle, always one of the things in my instruction is in the first week after the facelift, don't chew on a hard steak or something, because we don't want to bother those muscles which are already slow. Yeah.
Right, right.
Yes.
And I think a lot of
Miss Winnie, you
patients.
want to get
I'm
the
like,
She's ready? No.
So a lot of patients are concerned about the scars when it
Yeah.
comes to like the facelift. I've heard many people want to have a facelift, but they don't want to do it because they're thinking, they want to keep it confidential. They don't want people to see their scars.
Yes.
What would you say to those?
I say go back and check my before after picture. It's barely you can see the scars on the facelift.
Yeah.
Barely. And let me tell you something. On ladies it's much easier to hide the scars. You ladies of the hair
you have
right
hair.
now. You cover easily, you can cover if you want, yes. But the facelifts on men, because we have the mostly short hair, so the incision should be meticulously sitting in the skin creases to make sure over time it is gonna be invisible. And no, I always reassure when somebody has that concern. I just show them the pictures of before after. They can see. After they heal, barely you can see. Yeah.
Right. And I think what makes a difference with the procedures that you do for our patients is that you're not so aggressive. I think you're always considerate and you're always going with the more natural look, and I think that's what people love the most.
Yes. I have something I call it regain the youth. Regain the youth. And remain the result and the same character. So, and that's always I follow that line to make sure on the facelift the patient's personality and character doesn't change. It's the same person, but the few years of the youth is coming back. That's very true. I think we just have 5 minutes or so.
Yes,
Wow,
we do.
time flew
I know.
today.
Yeah.
Yes.
All right, if you want to make any announcements.
Yeah. Well, going back to what we said earlier, we do have a breast cancer awareness walk this month. It's next week. There's still time. We have our Dr.K t-shirts.
Yes, if you can pass in one of those to
I
us.
don't know if it's locked.
Yeah.
Yes.
Yeah, probably
No,
is.
Oh,
they're locked.
Yeah.
No worries.
So we'll
Next-
show,
next
yeah,
week
we'll
we'll
show
show
them
you.
next time. We're actually wearing them on the videos. If you can see it on our Instagram profile. You can also swipe up, and we have the link on the bio, right? Yeah. So you can follow there. So anyone that can donate $50. It can go towards any surgical procedure. You get a $500 credit, right?
Yeah.
Cool. Yeah. So you'll be getting one of these little pins that we're all sporting here.
I have it right there.
So
And by the way, I tried the t-shirts. They're really good quality.
Oh, really?
They're
the
not
t-shirts
Gucci,
are-
but-
no, they're soft, they're good. So
Yes.
everyone will be getting one. So yeah, just support us.
Very good.
And our event is on October 13th
Yeah.
for
Yes.
the cancer walk.
Cancer walk.
Saturday,
All call us.
October
Mhm.
13th. Very good. That one.
Yeah.
Yes,
we
very
have
good.
two
Yeah.
here.
Yeah.
We also have the Zeo Peel.
Skincare peel.
If you want to tell us.
It's an evening event, and that is on October 18th. That's on a Thursday. Call us to make your appointment. You will get a peel and $50 credit towards any product. We will analyze your skin. A lot of people may have a skin condition like acne, or even if it's just anti-aging, or just to prevent it all. So call us and we will schedule your appointment.
Very good. Thank you so
Thank
much for
you.
following us. And we try to provide the educational points. And if you have any question, any doubt, you can always contact us from anywhere. Chile.
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 Thank you.
Chile. All right. Thank you.
Bye-bye.
Bye.